5 silent killers. These are the 5 killers that my staff identified. Some of you have experienced some of these things, and hopefully not all of these things, but chronic kidney disease, hyperthyroid disease, diabetes mellitus, cardiac disease, and cancer. And the last one is cancer. And it's always a difficult one for us to deal with. Obviously, weight loss, not eating, vomiting, diarrhea, difficult breathing. Sometimes we'll see that abdominal distension or bloating as well. Weakness, lethargy, hiding, fever. They just kind of waste away. This is an ultrasound and an x-ray of a guy that has intestinal lymphosarcoma, and there's the tumor right there. And when they get that big, oftentimes we can feel it in the belly. And this is a very specific x-ray. You can see that the walls of this intestine are really kind of calcified, and there's not a channel anymore to take food through that. So that's why they don't eat. They get food down, you know, as far as here, and then can't go any further. So, you know, it backs up in their stomach. Sometimes they vomit because they feel overfull. They'll just nibble because they can't pass food through. Digestion is happening before this spot, so many times they do okay with small multiple meals as long as it's located in one little area. Ultrasound to see if we had a mass that we could remove, or whether it was something that was spread further. Here's that mass. So see, you can get food up to here, and then it can't go any further. Eventually, it went through that mass for a long time, slower and slower and slower, until it couldn't go through it all. And these are the little cells on oncology that if we walk out and say, we had lots of blue cells, or lots of basophilic cells, that's a basophilic cell, that really blue cell. It's what they call an monotomous population. You can see there are kind of lots of those little cells that are just about the same. And that's lymphosarcoma. And you can do chemotherapy on those. Sometimes you do the small multiple high protein meals. Prednisolone therapy will actually kill off some of the lymphosarcoma cells for a short time, so they feel better. Also, makes them just a general well-being. They feel better. And so they'll eat and they'll play a little bit more. Again, antiradical vitamins. Sometimes we just choose humane euthanasia. Sometimes we can do surgery on these guys. So, best care recommendations. Eat a high-protein diet. Did that come through? Yeah. And lots of fresh water. Physical, so we can catch some of these things twice a year as seniors. Keep their teeth clean and healthy. Lots of enrichment. And some of that is just because it's good for you, and some of it's because it's good for your cat. But it also lets you know what's normal. So that if you start to see, oh, we're not playing with that laser. Which, by the way, you always, if you're playing with a laser with a cat, they have to win sometimes. So you have to, you run the laser around on the floor and they're chasing it, and then you spot it on a piece of treat, and you let them get the treat. So periodically you let them win, because otherwise you'll create this neurotic cat that runs after everything that's shining. And it makes them very frustrated, and they're very stressed out. So always let them win some. Lots of enrichment, and a very clean litter box, because then you can tell if your clump is usually this size and all of a sudden it's, because we want lots of healthy cats that we see here. Thank you.